definition of HIV. HIV is a virus that attacks the body's immune system. If HIV is not treated, it could lead to AIDS. Until today, there is no effective cure for people who are having this virus. But if they are getting the proper medical, it can be controlled.
Definition of AIDS. AIDS is the last stage of HIV infection that occurs when the body's immune system is badly damaged because of the virus. Most people with HIV do not develop AIDS because taking HIV medicine every day as prescribed to stop the progression of the disease. A person with HIV is considered to have progressed to AIDS when the numbers of CD4 cells is less than 200 cells per millimeter cube. For normal person who has healthy immune system, the numbers of CD4 cells should be between 500 to 1060 cells per millimeter cube, and they develop one or more opportunities infection regardless of their CD4 numbers.
Now, let's get to know the hepatitis C. Hepatitis C is a liver infection caused by the hepatitis C virus HCV. HCV can be short-term or a long-term illness. Acute HCV can occur within 6 months after a person is exposed to HCV. Without treatment, chronic HCV can cause liver cancer or severe liver damage that can lead to liver failure. HIV is a contagious infection that can spread from person to person.
When foreign invaders, such as bacteria and viruses, get into your body, they can cause infections. These events activate your body's defenses. The white blood cells of your immune system are part of your body's defenses. One type of white blood cell, called helper T lymphocytes, or helper T cells, strengthen your immune system's response to infection in 2 ways. First, helper T cells release chemicals that attract other white blood cells to the site of the infection. These additional white blood cells attack the invading bacteria or virus, as well as other infected cells. Second, helper T cells release chemicals that cause other white blood cells to multiply. These new white blood cells create markers, called antibodies, which can identify the same foreign invader throughout your body. Antibodies attach to the bacteria or virus, marking them as targets for your immune system to destroy them. If you have HIV, it travels through your blood and other body fluids to infect and kill certain white blood cells. The virus enters helper T cells, which are the primary target. Once inside, the virus makes many copies of itself. As these virus particles are made, they leave the damaged helper T cell to infect other cells. The T cell loses its ability to protect the body from the ongoing infection and dies. In this way, HIV spreads and kills more of your helper T cells, weakening your immune system. As a result, other types of infections are able to take advantage of your body's inability to defend itself. These infections are called opportunistic infections. If you have an HIV infection and one or more opportunistic infections, you have AIDS.
Hepatitis C is just a virus. It doesn't do a whole lot other than want to live in your liver and make more copies of itself. So the word hepatitis has to do with hepa, which is the liver, anything having to do with the liver, itis, which means irritated or diseased. And we know that there are different viruses that once they're in the body, their home base is the liver. The primary viruses we see in this country are hepatitis A, hepatitis B, and hepatitis C.
So anytime someone was exposed to someone else's blood, and that could happen through blood transfusions before 92, organ transplantation before screening, people on dialysis, people with hemophilia, as well as people who inject drugs. All were identified as high-risk populations, as were people living with HIV, because many of the same modes of transmission for HIV are also true for hepatitis C. Their immune system tries to fight it, and this battle goes on in a very silent way in their liver for 10, 20, 30, 40 years. And it may also be causing other problems. Hepatitis C is linked to things like the development of type 2 diabetes, as well as lymphomas and kidney disease. But what happens to some people is over time their livers scar, leading to cirrhosis. But it's only at that stage, when the liver can no longer function, that symptoms become obvious.
When you're having all that itching, that's because your liver was acting up.
I had no symptoms. It didn't affect anything that I was doing. So I didn't respond to it.
And once you get cirrhosis, your liver can stop working.
And the idea is, if you don't know you have it, you can't get the treatment and you can't be cured.
Among people living with HIV, routine liver function tests sometimes reveal elevated liver enzymes that can be a sign of liver inflammation due to hepatitis C. When they do occur, signs and symptoms of acute hepatitis C infection may include the following: mouth ulcer, fever, sore throat, rashes, fatigue, nausea, vomit, and muscle aches.
As we can see, this disease may lead to harm and death. For that reason, some precautions should be taken in order to avoid this disease from our life. First and foremost, we should never inject drugs that is surely illegal, as well as sharing the needle. Personal items like toothbrush or razor should not be shared, as the contact with blood may cause the infection. Next, partners should use condom during sex and limit their partners. Ultimately, partners with this history should do a HIV test in order to ensure their health. People with HIV, AIDS, and hepatitis C need the specific treatment so that this disease can be treated. For HIV sufferer, antiretroviral therapy (ART) is needed, where a combination of daily medicine to stop the virus from reproducing and protects the cell. For AIDS sufferer, nucleoside reverse transcriptase inhibitors (NRTI) is used at the late stage of HIV, where the drug treatment helps to reduce the HIV in their body to keep the immune system as healthy as possible and decrease the complication. Finally, direct-acting antiviral DAA tablet is given to hepatitis C sufferer for 8 to 12 weeks to treat the disease.
Have you ever wondered what is the connection between HIV and HCV? Well, both HIV and HCV can spread in blood. A major risk factor for both HIV and HCV infection is injection of drug use. Infection with both HIV and HCV is called HIV-HCV co-infection. In people with HIV-HCV co-infection, HIV may cause chronic HCV to advance faster. You can have HIV and not know about it. Hepatitis C can also be symptomless. It's important to treat your hepatitis right away, even if you feel fine. It can damage your liver more seriously if you have HIV. Hepatitis is a major known AIDS-related cause of death among those who have HIV positive. Untreated hepatitis can lead to cirrhosis, liver failure, and liver cancer. Both HIV and hepatitis C can spread through blood, semen, mucus, and also other body fluids.
On our questions survey, do you know that in Malaysia, 87,041 people at the end of year 2018 have been living with HIV? From our respondents' answer, there is most of them will not know about this. 12% of our respondents know about this statistic, and the another 30% was not sure about this. So let me share with you about this. Reported on the Global AIDS Monitoring Report 2019, which are coordinated and produced by HIV or STI or Hepatitis C sections of Ministry of Health Malaysia, recorded at the end of year 2018, it is estimated that 87,041 people live with HIV in Malaysia. 75,040 of whom were notified through the National Surveillance System. By December 2018, 55% of the reported persons live with HIV will receive antiretroviral treatment (ART). It is also reported that new HIV infection has declined by more than 50% from year 2002, with 6,978 cases new HIV notification, which is equivalent to 28 cases per 100,000 population, to 3,293 cases in 2018, which is equivalent to 10 cases per 100,000 population. While the estimate HIV incidence rate per 1,000 uninfected population has also gradually declined to 0.25 in year 2018. Based on the report recorded on the Global AIDS Monitoring reported, it showed that this statistic was the truth.
For this question, do you know that HIV or AIDS and hepatitis C have the same methods of transmission? Show that the highest percentage is 40%, which is yes, that those viruses have the same methods of transmission. The second highest is 36%, which is no, while the lowest percentage is not sure about this transmission. The answer is yes, because from this article stated that as HCV is a blood-borne virus transmitted through direct contact with the blood of an infected person, co-infection with HIV and HCV is common among injection drug users who have HIV.